Hi, I'm Dr. Tracey Marks, a psychiatrist, and I make mental health education videos. Today, I'm talking about having a fear of losing control and how it can lead to social anxiety. Social anxiety disorder is a disorder where you experience intense anxiety when faced with a social situation or needing to perform in front of others. And in this case, performing goes beyond playing an instrument on a stage or public speaking. It can be anything that you need to do in front of people, like ordering from a menu, eating in front of people, urinating with someone nearby, or answering questions in class. You may think, these situations make me uncomfortable too. Does that mean I have social anxiety? Not necessarily. There's a certain amount of angst or nervousness anyone can have doing something in front of people. Some people have more confidence with this than others. The difference between normal social anxiety and a disorder is people with social anxiety disorder have an intense fear of being humiliated or judged, and because of these fears, they avoid situations like this at all costs, like maybe skipping school or calling out sick from work every time you need to present something. Avoidance is one of those things that reinforces the fear and makes it worse. The more you avoid the situation, the more anxious you become when you're forced to deal with the situation. Fearing uncertainty is one of the baseline fears behind anxiety disorders, including social anxiety. Some people are better able to tolerate not knowing the future than others. But another fear associated with social anxiety is fear of losing control in front of people. This is not a fear you would experience to any significant degree if you had normal social anxiety. You essentially fear losing control over your emotions, physiology, or your behavior. And here are some examples. You may fear that you'll suddenly snap and start acting irrational in front of people. You fear that you'll be triggered and lash out at someone physically. Or you'll lose control of your bowels and either poop in your pants or make a lot of noise in the bathroom and people nearby will hear you. You may fear that you'll lose control while you're driving and hit someone. And this is a fear that some people with OCD will have that causes them to compulsively backtrack their path to make sure that they didn't hit someone while they were driving or just stop driving altogether. These fears would be considered maladaptive beliefs about future outcomes. That's how we look at it. The reason they are not the usual thoughts of someone with a normal level of anxiety is that people with the disorder of social anxiety have a negative bias that skews your thoughts towards things that confirm your negative assumptions. So, for example, after you engage in a social situation, you review how things went and overly focus on negative cues. This is referred to as post-event processing. For example, you can say, I saw this person in the corner yawn while I was talking, which means I was boring. Or when I walked out of the bathroom, people were laughing because they were listening to me. I made a fool of myself and people are disgusted by me. Through the post-processing, you gather evidence that reinforces your negative views of yourself. I'm socially incompetent. I'm not capable of pulling off a good impression. People don't respect me, etc. This process generates more anxiety when you anticipate a new event. You carry over these negative biases onto the future event and believe that you will humiliate yourself even further when you lose control of yourself. Another form this fear of losing control can take is fearing you will lose your mind and go crazy. Sometimes people with general anxiety can feel this. Their general anxiety is not focused on social situations or performing, but they can feel that their internal anxiety will continue to escalate to the point that they just lose it and start acting hysterical, making someone think that they need to go to the hospital, or they can fear that their loss of control may cause them to sabotage a good thing that they have going, or even hurt themselves or someone else. Usually, the more intense the anxiety, the more likely you think that you're going to lose it. What's the difference between having this fear and having an obsession? It depends on how persistent the thought is. It can be a subtle distinction. Anyone can become obsessed or over-focused on a single thought, but people with obsessive compulsive disorder have thoughts that are intrusive, meaning they pop into your mind at unwanted times. The person with general anxiety or social anxiety can fear losing control, but this is a belief that runs in the background and informs their decisions about things. You're not actively thinking about it all the time, and the fear doesn't necessarily overwhelm you, but it can keep you from wanting to go places or make you feel very anxious when all eyes are on you for something. You can think of an obsession as a more active thought that interferes with your other thoughts. You can't easily distract yourself from it so that you can just continue going on with other things. And this is where compulsions come to the rescue. Compulsions are behaviors you engage in to lessen the anxiety from the obsessions. Also, with the obsessions, there can be a mixture of pure thought or fantasy and then images. A fantasy would be me fearing that if I go to this place tonight, I might get triggered and become enraged. I don't necessarily play out in my head what would happen if I got that angry. I just know that I don't want to go there. But the obsession gets darker if I see images of myself in a rage throwing things at people's faces. I can even see an image of my superior looking shocked while they're holding their bloody nose. Then, if I had OCD, I may fiddle with my hands to offset the act of throwing something. Doing this 10 times makes me feel less anxious because I feel that my hands are occupied and unable to do something bad. So that's a hypothetical example of the difference between having a fear that affects your behavior and decisions you make versus an obsessional level of fear that consumes you and results in compulsions. Fear of losing control is something that anyone with anxiety can experience, but a new research study shows that it may be something that can lead people to developing social anxiety. If you do have these fears, what can you do about it? There's several approaches, usually done best with the help of a therapist. One approach is called systematic desensitization, and this is a form of exposure therapy where you face your fears by placing yourself in situations that resemble the situation you fear. If I fear becoming hysterical and out of control in a group, I can test my assumption by interacting one-on-one at first, then moving up to a couple of people, or being around familiar, safe people, and then being around strangers. Another approach is to challenge your assumptions, especially the ones you make during the post-event processing that you do after you've been in a social or performance situation. For example, suppose I fear that if I speak in a group, I'll start gagging uncontrollably. The last time I went out, I felt a lump in my throat, which reinforced that fear. Feeling a lump in your throat is a symptom of anxiety, so it's no surprise that while feeling anxious in this group, I felt a lump. But in my post-event processing, I saw that lump as evidence that the gagging was about to start if I hadn't left when I did, or that the lump was a warning sign that the next step would be choking. Kind of like being repeatedly exposed to something if you're allergic. The allergic reaction just keeps getting worse every time you have another exposure. It's a similar kind of thinking. I had this symptom, next time it's just going to be tons worse. That's the distorted rationale I use to justify avoiding the situation the next time. And it makes sense in my head because it supports my negative assumptions about myself. But when I challenge the thought with a rational mind, I see the lump as simply an anxiety response that I can lessen by practicing some anxiety-reducing techniques the next time I'm in that situation, like grounding exercises, breathing, or making my vocal cords vibrate. You can learn more about that in this video called Using Your Vagus Nerve to Calm Yourself. I hope this was helpful. Thanks for watching. See you next time.